Have you ever felt your heart racing for no clear reason or felt trapped in a cycle of worry you just can't escape? Maybe your mind races at night and you wonder, what's wrong with me? If so, you are definitely not alone. Anxiety is one of the most common mental health challenges worldwide. But there's a good news. Anxiety disorders are highly treatable. In today's video, we are diving deep into what anxiety really is, how it shows up in your body and mind, and the full range of treatments, from therapy techniques to medications to lifestyle changes. Stick with me to the end. This might be the most important 10 minutes to spend on your mental health. My name is Dr. Raza. I'm a practicing family physician in USA for the past 18 years. I'm an American board-certified physician and diplomate of American Board of Family Medicine. What is anxiety? First, let's answer a simple question. Anxiety is a natural human emotion. It's part of our built-in alarm system, the fight or flight response. When we are faced with danger, anxiety helps us react quickly. It's normal and even helpful in certain situations. But there is a problem. When anxiety becomes chronic, excessive, or disconnected from any real danger, it crosses the line from a normal reaction to a mental health disorder. And that's when it starts controlling your life instead of protecting you. Anxiety disorders affect people of every age, background, and lifestyle. Left untreated, they can be seriously disruptive in relationships, work, school, and your overall sense of well-being. Now let's talk about the types of anxiety disorders. There are several types of anxiety disorders. Let's quickly go through some of the most common ones. Generalized anxiety disorders, or GAD, constantly worrying about everyday things, work, health, family, without a specific reason. Panic disorder, sudden panic attacks, intense fear, racing of the heart, sweating, often out of nowhere, a fear of impending doom. Social anxiety disorder, fear of being judged or embarrassed in social situations. Specific phobias, extreme fear of specific objects or situations like heights, spiders, snakes. Obsessive compulsive disorders or OCD, intrusive thoughts called obsessions and repetitive actions called compulsions to try to ease anxiety. Post-traumatic stress disorder, PTSD, anxiety triggered by memories of a traumatic event like a soldier in a war zone. So how does anxiety actually feel? The symptoms can vary from person to person, but they generally fall into four main categories. Let's go through them one by one. Physical symptoms. These are the sensations that you feel in your body when anxiety hits. Rapid heartbeat. Your heart feels like it's pounding. Shortness of breath. Muscle tension. Your shoulders and neck might feel tight. Sweating. Fatigue. You feel exhausted even if you have not done much. Headaches, dizziness or lightheadedness. Stomach issues like nausea or diarrhea. These symptoms can be scary, but they are not dangerous. They are your body's way of preparing for fight or flight response. Cognitive symptoms. Next three are cognitive symptoms, how anxiety affects your thinking. Persistent worry or fear, difficulty concentrating, racing thoughts, indecisiveness, catastrophic thinking, always assuming the worst will happen. It's like your brain is stuck in overdrive and thinking negative. Number three, emotional symptoms. Emotional anxiety can leave you feeling irritable, restless, on edge, like something terrible is about to happen, a sense of dread or doom. It's exhausting to live in a state of constant alarm. Behavioral symptoms. This might look like avoiding situations that makes you anxious. Compulsive behaviors like repeatedly checking things or washing your hands, withdrawing from social life, trouble performing school or work. If your anxiety lasts more than 6 months and affects your daily life, it's time to seek help. Now, comprehensive treatments of anxiety. Treatment is tailored to each person. It usually combines psychotherapy or talk therapy, medication when needed, lifestyle changes, and self-care strategies. Let's go deeper into each one. Behavioral counseling and psychotherapy. Therapy helps you to understand what's driving your anxiety, teaches you coping skills, and helps you change negative thinking patterns. There's several powerful therapy techniques. Let's explore them one by one. Cognitive behavioral therapy, CBT. One of the gold standard of treatment is cognitive behavioral therapy, or CBT. CBT helps you recognize and change negative thoughts and behaviors that fuel anxiety. It is built on the idea that our thoughts, feelings, and actions are connected. Meet Sarah. Sarah has a social anxiety. She believes if I speak up in a meeting, I'll say something stupid and everybody will laugh. Here's how CBT helps. Her therapist asks, is there any evidence people will laugh? Has that actually happened before? Sarah challenges her thinking and realizes even if I stumble, people are usually supportive. Everyone makes mistakes. Then she practices speaking in small groups. She sees people respond kindly and gains confidence. Over time, Sarah's anxiety decreases because she replaces irrational thoughts with realistic ones and stops avoiding situations. CBT is structured usually about 12 to 20 sessions and is proven effective for many types of anxiety. Number 2, exposure and response prevention. Another powerful therapy. What is it? ERP is special type of CBT, especially help for OCD and phobias. It involves facing your fears gradually without performing the usual rituals or avoiding the situation. Here's an example. Meet David. David has contamination OCD. He feels the urge to wash his hands repeatedly after touching doorknobs. ERP works like this. His therapist has him touch a doorknob in the office. David is then told not to wash the hands. His anxiety spikes at first, but as nothing bad happens, it slowly decreases. Repeating this helps David learn he can tolerate discomfort and that his fears are not as dangerous as they seem. Number 3, mindfulness-based therapy, MBT. Another approach. What is that? Mindfulness therapy teaches you to focus on the present moment without judgment, so you can stop getting stuck worrying about past or future. Meet Priya. Priya has a generalized anxiety. She constantly worries about her job and her future. Her therapist teaches her mindful breathing, simply noticing her breath going in and out, observing thoughts like clouds passing in the sky without getting hooked by them or entangled by them. When a worry arises, like, what if I get fired? She labels it as just a thought and gently refocuses on the present. Over time, Priya becomes less reactive and more in control. Number 4, acceptance and commitment therapy. Finally, let's talk about that. ACT teaches you to accept uncomfortable thoughts and feelings instead of fighting them, while living a life that reflects your values. Here's an inspiring example. Meet James. James dreams of becoming a teacher, but he is terrified of public speaking. Through ACT, he learns acceptance. Instead of running from fear, he makes room for it. Diffusion. He seeks thoughts like, I'm a terrible speaker, as just words, not truth. Values. He realizes teaching is deeply meaningful to him. Committed action. Despite fear, he starts giving small lectures. The goal in ACT isn't to eliminate anxiety, but to live a meaningful life alongside it. Number 2, pharmacological treatments. Sometimes therapy alone does not work, especially for moderate to severe anxiety. In those cases, doctors might recommend medications like, let's go over them. SSRIs, selective serotonin reuptake inhibitors. SSRIs like sertraline, fluoxetine, or escitalopram are often the first choice for treatment anxiety. They increase serotonin, a neurotransmitter in the brain, improving mood and lowering anxiety. But remember, they can take up to 4 to 6 weeks to show full effects. Possible side effects: nausea, insomnia, sexual dysfunction, fatigue. Most side effects fade over time. Number 2, SNRIs, serotonin norepinephrine reuptake inhibitors. SNRs like venlafaxine or duloxetine are also effective, especially for GAD, generalized anxiety disorder, panic disorder, and PTSD. They both work on serotonin and norepinephrine pathways, neurotransmitters. Benzodiazepines like lorazepam, diazepam, alprazolam act quickly to reduce anxiety, but they carry risk of dependence and withdrawal, so they are only used for a short period of time. It can cause addiction and abuse. Buspirone. Buspirone is specifically approved for generalized anxiety disorder. It's non-sedating and non-habit forming, but takes few weeks to work. Number 5, beta blockers. For physical symptoms of performance anxiety, like a racing heart during public speaking, doctors sometimes use beta blockers like propranolol. Number 6, antihistamine. Finally, antihistamines like hydroxyzine can help short-term anxiety due to their calming effects and sedation, especially if you can't tolerate SSRIs or SNRIs. Lifestyle and self-management strategies. Besides therapy and medication, your lifestyle plays a huge role in managing anxiety. Here are some powerful self-care strategies. Exercising regularly lowers stress hormones and boosts endorphins. Eat healthy. Avoid too much caffeine, sugar, and alcohol. Good sleep habits. Keep a consistent sleep schedule and cut screen time before bed. Relaxation techniques. Deep breathing, muscle relaxation, and guided imagery can calm your nervous system. Stay connected. Talk to your family and friends so you don't feel alone. Journaling or creative expressions help process emotions and gain clarity. These habits won't ease anxiety completely, but they can make a huge difference in how you cope with it. Now, conclusion. Anxiety disorders can feel overwhelming, but remember this, they are treatable. With therapy, medication if needed, and self-care, most people find relief and go on to live happy, productive lives. Recovery does not happen overnight. It takes time, patience, and the courage to reach out for help. If you are struggling, please talk to a professional. You deserve to feel better, my friend. If this video helped you, share it. It could help someone else too. Thanks for watching and take care of yourself. Subscribe for mental health tips. Your well-being is my mission.